So let's talk about the health disparity known as cervical cancer. Cervical cancer is the second most commonly diagnosed gynecologic cancer in the world, known to have high mortality rates. But what causes cervical cancer? HPV, human papillomavirus, with 99.7% viral detection in cervical cancer cases. HPV can be symptomatic or asymptomatic. Most women contract HPV during their lifetime, especially at a younger age, and may not even know it. HPV and cervical cancer can be screened for and diagnosed during a gynecologic exam and a pap smear. So how can we protect ourselves? Primary prevention is receiving the HPV vaccine. Secondary prevention is screening with pap smear beginning at the age of 21. Although HPV vaccine and pap smears have decreased the incidence of cervical cancers, we're beginning to see the rates plateau. So what places us at risk for this health disparity? Socioeconomic status, minority groups, decreased health literacy and low levels of completed education, single women, rural areas, southern regions, and a lack of healthcare resources and a lack of healthcare access. So why are we seeing a plateau in the cervical cancer rates? Go back to some of the risk factors with socioeconomic status, low poverty, low financial resources, a lack of healthcare access, and a lack of healthcare insurance. So now the question arises on how to improve compliance and attendance with cervical cancer screening recommendation. Solution number 1. Free community student-ran clinics can help improve adherence to cervical cancer screening recommendations. Additionally, it can reduce the incidence and mortality rates of cervical cancers, and it allows students hands-on clinical practice. Solution number 2. Education is key. Providing frequent education about recommendations for cervical cancer screening, prevention of STIs, practicing safe sex, causative and risk factors, and HPV vaccine recommendations can help decrease the rate of cervical cancer. Evidence shows that a contributing factor to disparities of cervical cancer screening are related to a lack of trust and rapport with the provider, especially in minority, racial, and ethnic groups. With that being said, volunteer opportunities could be sought incorporating time to speak with potential patients in minority, racial, ethnic groups. As nurse practitioners, it is our duty to exhibit beneficence, ensure optimum quality of care, and decrease morbidity and mortality. It's important to be aware of and stay up to date on evidence-based practice guidelines for cervical cancer screening, but also consider creative strategies to reach and incorporate quality care.